Hello there, I'm Dr. Chris Rayo talking about weight loss. And since the first men's health book back in 2007, where they stressed BMI, body mass index, nothing I've ever wrote in that book way back in 2007, the first edition, has been proven wrong or unsafe. And the Midlife Health Guide for Women, first edition back in 2010. When the Women's Health Initiative trial came out, saying hormones are taboo. How could they be great for so long, for decades, and all of a sudden overnight? Taboo, and women were yanked off of the hormones because people didn't know how to interpret the data from that study. Women were running down the streets with hot flashes, night sweats, and all that. It was crazy. So, of course, since then, the professional societies have said that bio-HRT and that seems to be more safe than the artificial hormones, and it's acceptable and fine to do in the particular clinical situation, meaning look at your individual needs, and with anything you have to weigh the benefits and risks. I'm not going to talk about that now, but I do have blogs on that and also information on the website. Okay, the newest editions, 2025, they were featured in the New York Times. Please get a book. Everything you have to know. It's a workbook. Goes through diet, exercise, supplements, the newest peptides, and the GLP-RAs, i.e. Ozempic, tirzepatide, Zepbound, and all those, Wegovy, and such. So the two books there. So weight loss. So let's not look at weight loss. Let's look at health in that, and let's look at, as we age, we become more frail, okay? It's just part of life that, as a general rule, unless you're proactive, which we partner up with you to be that, you're going to lose the good stuff. You're going to lose muscle mass and bone mass, and you're going to gain fat mass. Premenopausal women will start to get andropause, where DHEA and testosterone starts to decline in the 30s. And of course, you have the fanfare with menopause, where estrogen, progesterone, and testosterone all dip. Men, it's andropause as well. Sneaky in the 30s, they gain the visceral fat, the granddad bod, the dad bod. That visceral fat is very bad because it increases your risk for metabolic syndrome, high blood pressure, cholesterol, diabetes, a triple threat that actually, as I propose, actually gives men the early mortality rate compared to women. Women have the pear-shaped, right, peripheral fat, not as ominous as visceral fat that surrounds all the important internal organs in the body. The liver, main cause for fatty liver, which is the main cause for liver transplant today, inflames all the coronary vessels and such to increase your risk for heart attack and stroke. So not good. So we're looking not so much weight loss, but body composition. That's what you want to keep up. BMI tells you weight per height. That's not good, right? For example, you could have a bodybuilder, all muscle mass and such, and he's overweight, but it's all muscle mass. So you say the person's unfit, weighs too much. That's not true, obviously. Don't tell him that or her that. They may punch you in the nose. On the other hand, the other end of the spectrum, you may have a frail 100-year-old man that's in a walker in a nursing home, and if the wind would blow, it would blow him over off of the walk, and he would fracture his hip. Right, weight per height, right? But it's all fat mass and lost bone mass and muscle mass. So it's what is the weight and where is the weight? That's one of the things we do here with our executive examination, which is very extensive, cutting edge, shouldn't be, except it is. Checks for markers of inflammation, the hormones, the glycosylation, your risk for prediabetes and diabetes, which, by the way, diabetes is about the worst condition you can have, causes premature aging of the body. So you get things when you're 50 years old you wouldn't get till you're 70 years old. That stickiness from the sugar coats everything in the body, the joints, the vessels, the synapses between the nerves, the immune system. If somebody is diabetic, you have 4 times increased risk for heart attack, stroke, dementia, and every cancer out there. Why? The immune system can't recognize self from non-self as well from the glycosylation. Anyway, that's the preface to things. So it's body composition. You want to keep muscle mass up and bone mass up. Why take all those drugs and shots for osteoporosis, right? Doesn't make sense. Main thing is to prevent the fall so you don't break things in the first place. Your functioning and your quality of life is high because you can get up to fix yourself a sandwich or go for a walk on a beach or to take trips. If you don't get sarcopenia, you won't get osteopenia. So that's enough of why you should keep your body composition up. The options out there. When you come in, we do extensive evaluation on your diet, on proper nutrition. Most women as they age, you don't get enough protein intake. The types of foods, the glycemic index of foods, how to control things like using a portfolio diet that lowers your LDL by 20% as much as most of the statin drugs would do, without drugs, okay? So the diet and exercise and interval routine, working with you, what are your limitations to design a program that works for you based on what your body composition shows. Now, let's get, so diet and exercise, of course, that's hallmark. You got to have the fundamentals right to lose weight. And when I say lose weight, I mean losing the undesired weight, the fat mass and such, okay? So, besides that, is to optimize hormones. Of course, the hormones keep your estrogen, progesterone, testosterone, DHEA up, which keeps your muscle mass, your bone mass, and fat mass down. That's not for everybody. It would be what's the best, safest thing for you to do. Besides that, we have all the drugs, right? From the appetite suppressants to our ExoMind transcranial magnetic stimulation machine that helps curb your appetite without drugs. Those on the GLP-RA drugs, the Ozempic, the tirzepatides, and those helps to decrease the side effects of those as well as the food cravings. The problem with the GLP-RAs too, if there's anything you take home from this too long video, is that with those drugs, half of the weight loss is muscle mass and bone mass. So you lose the good stuff too. People get that gaunt look. They look like they have a cancer or going through chemo or something which is like that, or AIDS, because they get that gaunt look. You don't want that, all right? So that's why you have to combine weight loss, not just those various drugs in that. There's different drugs as well that we can use besides those to help for your individual situation, depending on what the causes are, to help you lose weight and then to maintain your optimal body composition best way. I've had people lose 80 pounds of fat just doing the diet that's recommended in these books, and it's a diet that you can keep for life, okay? So come on in, we'll optimize your body composition. Again, two of the main things, keeping your brain up. A healthy brain's a healthy body, and a healthy body is a healthy brain. A brain is an organ inside the body, so if there's inflammation or B12 or folate's low, the thyroid's off, various medications can cause one to start to have some mental and health issues as well. So we look at the total person from the inside out, using first of all what's safe, secondly what's proven effective in the literature out there. We monitor things as well. Dr. Chris Ray, I've done this for 3 decades. I've taught physicians that's worldwide through the A4M, the National Procedures Institute, guest lecturer and author for 3 decades, not somebody that owns a franchise that has nothing to do with medicine or trained in it or went to a weekend course. So we work from the inside, and we also have done full aesthetics from the fillers to the neurotoxins, aka Botox and all that, but we use different ones depending on what your needs are. The Xeomin and Daxify and stuff. I was doing fillers before they even had the synthetic ones where we had to do a skin test for bovine collagen to inject that. Plus all the machines with no downtime, the M-Face and the Exion. So that's my little bit there on weight loss, but it's actually body composition. Thank you, Dr. Chris Ray, Unison Pro-Youth Institute in wonderful Stuart, Florida.